I have a short presentation on what exactly a literature review is and how to go about writing one. So what is a literature review? The simplest way to say it is it's a critical recap of what has already been researched on a topic. It is simply catching up someone on what is already known about this topic. It provides that overview of current knowledge. It identifies the relevant theories and methods and even the gaps in the current research. So a good literature review in our situation especially begins with a really solid and clear PICOT statement. And everyone should be pretty aware of what's involved in that PICOT statement, but it begins with the problem or the patient or the population. That can be in adult ICU patients or in pediatrics with depression or in patients on the medical surgical unit undergoing colorectal surgery. It can be so many things. It's just honing in on the exact problem or patient. The intervention is what you're going to add or subtract or change in the situation. The comparison is typically the absence of that intervention. And then the outcome is what you hope to desire with the intervention. Time is not necessarily always necessary, but it is hopeful. It kind of puts a time limit on the project. So is this intervention going to be tracked for 3 months, 2 weeks, 6 months? It can be any sort of time frame. I'm going to go through 2 PICOT examples. The first one deals with the problem population, adult ICU patients with Foley catheters. It's pretty common knowledge that Foley catheters can have a high infection rate called COTIs. The intervention would be implementing a nurse-driven Foley catheter removal policy, essentially a policy that allows nurses to remove this catheter when it's no longer necessary. Comparison would be the not having the nurse-driven Foley catheter policy. So whatever the facility is doing at the time, it's usually a physician order. The outcome desired would be a decrease in catheter-associated urinary tract infections, COTIs. And the time, really, like I said, can be anything. I threw in 6 months. That's a lot of time to track the changes that may occur with COTIs and a nurse-driven Foley protocol removal. So you take all those things, kind of combine it into a beautiful statement. In adult ICU patients, does implementing a nurse-driven Foley catheter removal policy compared to not having a nurse-driven removal policy decrease catheter-associated urinary tract infections over the course of 6 months? That one's a little wordy, but it does the job. Second example, we have our population, adult patients undergoing colorectal surgery. Side note, this was my PICOT statement when I had to do my last project. Intervention, implementing enhanced recovery after surgery, the ERAS interventions. Comparison, the absence of those interventions. So whatever way the hospital was handling colorectal surgeries before ERAS. Outcome desired, decreased hospital length of stays. Time, again, 6 months. That's whatever. In adult ICU, or not ICU, in adult patients undergoing colorectal surgery, does implementing enhanced recovery after surgery interventions compared to the non-ERAS interventions currently used decrease hospital length of stays over the course of 6 months? So now we need to learn how to tie that PICOT statement into our literature reviews. As I said, the PICOT statement, it's the main guide to the literature review. It's this driving force of performing a literature review. From the PICOT, you will brainstorm and develop keywords to use to search for related literature. And that, like I said, again, literature reviews begin with this specific and strong PICOT statement. There are many sources of steps of a literature review. I found these 5 pretty relevant. First is the searching. I'll go through all these more in detail. Then you're going to evaluate the sources, identify themes and gaps, outline the structure, and then write it. So the first step, searching for relevant literature. This step really involves dissecting the PICO statement, and I will get to this on the next slide a little more. So it involves brainstorming keywords, establishing synonyms, finding other phrases for what you're already saying for these key concepts. I'm going to go to our first example. That was the nurse-driven Foley catheter removal PICO statement. So the problem and outcome kind of together, I kind of put these into two groups, is catheter infection. And as you can see, I listed a bunch of other words. We have Foley catheter, ICU Foley catheter, indwelling catheter, urinary catheter. All these words are synonyms for the same exact thing. And then the infection, we can search CAUTI, catheter-associated urinary tract infection, urinary catheter-acquired infection, Foley infection, catheter infection, and probably many, many more. That was just a list I had going of all these related concepts and synonyms for catheter infections. And then the intervention of that PICO was nurse-driven catheter removal protocol. So other things that may trigger our search is Foley removal, nurse-driven protocol, nurse intervention, Foley catheter interventions, and like I said, probably many more. The point being, you're trying to really brainstorm other words to describe your PICO concepts. So when you search for literature, the first database that is probably best to use in our situation is the GCU library. Honestly, it's a great resource. It has so many other resources involved, and you can simply check the box that says peer-reviewed. I'll get to that later, but that's really important to do. EBSCO, Google Scholar, anything outside of the GCU library, you do have to be more cautious and make sure that you're getting legitimate articles from legit databases. Like I said, always check that peer-reviewed tab if the option exists. I will get to that in the second step, but it is very important that you check that tab. And then when you're searching for literature, don't ever just read a whole article. Read the abstract first. Determine if it's even going to be anywhere near relevant to your literature, or to your PICO statement. Abstracts in good research really go over the key ideas. So the abstract, it's essentially a short summary of what the whole article is about. It'll have the context or background information of why they did this research. It'll typically have a central question or problem that it's addressing. Sometimes they'll tell you what's already known, and then it will often give the research methods, which is important. And then it will discuss the main findings, results, and the significance or implications of the study. So the abstract is super important. It literally summarizes the entire article in what can take 5 minutes to read. So quickly read through those, determine if they are even relevant to your study, or to your PICO, and if they're not, then move on. If they are, save them away for for your literature review. The second step is to evaluate the sources. So the big part about this is determining the credibility of the source. With literature reviews, you only want to use sources that are credible. We kind of talked about the peer-reviewed and how important that is, but a few things to determine the credibility is an acronym CRAAP. So currency deals with how recent is the source. So was the source published 3 years ago, or was it published 20 years ago? If it was published 20 years ago, that is not relevant. It's too far, we've advanced way too much in the last 20 years. Typically, you want something within the last 5 years. That's considered a good currency. Second is the relevance. This is the source related to your PICO topic? Is it relevant to what your paper is going to be about? Authority, is the author credible? So who wrote this? Are they a credible person? Is this someone that has education? Is this someone that maybe is affiliated with the university? Someone that does research? And then again, is that source peer reviewed? So talking about peer review a little bit, peer review is a process that occurs when an author has recognized researchers in the field and has had them read and evaluate their article before they submit it for publication. So basically these peers suggest if the article should be published, revised, or rejected. So basically it's a form of accountability to get a stamp of approval from people in that line of field that the study was done in. The fourth thing is accuracy. Is the information accurate or not? Usually a skim of the abstract can tell you if the research is fairly accurate or not accurate. If it's totally out of this world, it's probably not accurate. And then the purpose, the big thing on this is to be able to recognize if a source has a biased view or agenda. The third step in a literature review is to identify themes. So one of the major goals of lit reviews is to ensure that there's a theme of literature supporting your PICO statement. So you want to develop this theme. You want to look for trends and patterns among the literature, and then see if there's any sources that disagree. That's just something to kind of take note. And if your sources are disagreeing with each other, you probably need to do more research and see where the main theme is at in that conflict. And then where do sources disagree? Do the recurring concepts support your PICO? And then this is also when you can find some of the gaps in literature and the weaknesses. So what is missing? Is there still something that you need to find in literature that supports your PICO? The fourth step is determining a literature review structure. There are 4 main structures that can be used. Chronological, it's going to trace development over time. It's in order. Thematic is kind of when there's lots of different themes. Methodological, types of research methods, so maybe quantitative versus qualitative. And then most commonly is the theoretical framework. This one's the most common one used for PICO statements. And this is when the literature review is in an order that best aligns with the order of the PICO statement itself. So kind of back to our original example in the ICU patients, in adult ICU patients, implementing the nurse-driven Foley catheter removal policy, does that decrease COTIs over 6 months? So with this PICO statement, we would want to organize the articles in a manner that supports nurse-driven catheter removal policies. So the first article that we may do in our lit review, it could be maybe a study about the amount of COTI infections among ICU patients. We're kind of establishing the need for change. The second article may be a study done regarding COTIs and a non-nurse-driven protocol, such as physician order only. So maybe the second article kind of shows again that there needs to be a change, and it's just kind of still supporting that idea. The last 2 articles in the review may be about how implementing a nurse-driven catheter removal protocol decreases COTIs in patients. So we kind of, in that order, we were establishing that we need an intervention, and then we end our literature review with a few pieces that affirm that this intervention is going to work and that it's a good intervention. The last step is to actually write the literature review. And the first page is the title page. And kind of along the lines of this, I cannot stress enough, the GCU library and Purdue OWL are 2 really good resources for APA formatting. Both have sample papers that tell you exactly how to write a title page, as well as the whole paper, really, how the formatting works. But these are great resources to make sure your title page and all the other APA formatting is how it should be. Next part of this lit review is the introduction. A lot of times I use the introduction to introduce the topic and facts about the topic, which in our case is the PICO statement. So back to our example of the nurse-driven Foley removal policy in adult ICU patients. I may, in this introduction, talk about how many adult ICU patients have Foleys, may talk about facts or statistics related to Foley infections, CODIs, and just really kind of introducing the PICO statement. I think that involving the PICO statement in the literature review is a good idea personally. In all my literature reviews, I always have my PICO statement present after the introduction. Then the next section is when you start reviewing each piece of literature. So with each piece of literature, you are not rambling on, you're just summarizing and synthesizing each piece of literature. So kind of giving the main points of what this literature has, its findings, maybe some of its implications. Again, you're just summarizing, giving this overview of the main points of this source. You can add your own interpretations as appropriate, so you're analyzing and interpreting a little bit, mostly discussing the significance of findings in relation to the literature as a whole, and then evaluating the article in light of your PICO. The last step of the literature review is the conclusion. This will include recommendations for future research. So in any research, there's going to be gaps or things that need further research. And this is that chance to kind of make those suggestions. And then very importantly is the references. And again, GCU Library, Purdue OWL are so helpful on getting your references in the correct format. A few other key points just to talk about. I kind of just did, but the literature review cuts to the chase and gives the key points of the literature. It does not ramble. They are short and sweet and, just give the overview of this article. It reviews major works from your narrow topic, which is your PICO. Again, sources must be peer-reviewed. This adds validation to your data and to your literature review. The literature review creates a relationship from research already done to your PICO. So I've read from the discussion boards, everyone's PICO statement. There's definitely very adequate research done on all of these PICO statements. So it is creating that relationship from what we already know, what's already out in the world, to our current PICO. And then literature reviews, the whole point's to fill the reader in. We're bringing them up to date or up to speed regarding the content of the PICO. So that concludes kind of an overview of literature reviews. If you guys have any questions, feel free to reach out. I'll try to answer them